In conjunction with the City of New York, Pace University and Vital Care Services partnered to conduct a 6-month pilot study of 4 community locations of up to 100 patients total.
This was a fully funded study by the City of New York to pilot and test telehealth solutions in diverse senior living communities.
For me, working with Vital Care has been a great experience. I think telehealth is going to be more and more present in our society. I think we're going to see greater uses of it.
The technology, I just love it because it just shows how the 21st century can be adapted into a 20th century kind of environment. Basically using a blood oxygen meter, blood pressure meter, a weight scale, all Bluetooth synced into a tablet, and it's just very simple.
And they're also taking mine as well as the other technicians' comments. There's certain things about the interface. We're like, hey, if the font could be bigger, or if we could have a certain messaging tool, they fix it the next time they come to visit. So they're constantly in motion.
As a telehealth nurse, I'm able to see up to 50 or 60 patients at any one point in time.
Well, I believe that telehealth comes in and supplements what we do in a very sophisticated way, if you will, by using technology. So it really enhances the services because it allows us to do the client engagement piece, but as well understand what the client is experiencing over a course of days, as opposed to an isolated incident where they may come down because that day they didn't feel well.
Vital Care impact on financial cost savings is huge. This is a very cost-effective way to give very detailed and timely health monitoring service to our seniors.
Vital Care has been instrumental in helping our residents maintain a healthy and positive experience in taking care of their own health needs. They come down each week and they're eager to find out what's going on, how their blood pressure is doing.
What happens is a technician goes to various sites and takes the blood pressure, the O2 saturation, and the weight of the research participants. And then I'm able to log in remotely and check all their information for that day.
It's a major improvement for health, and so it's saving people trips to the doctor. Living especially up on 191st Street that these people do, it's a really big trip to go to Columbus Circle or even into the village to go to their doctors.
I have quite a few conditions, and I like to keep check on them, and having this makes me keep check on them, otherwise I wouldn't.
I like the idea that I know what I weigh every week, I know what my pressure is.
I think it keeps me more aware of what's happening with my body.
The sites that I'm working with Vital Care are relatively low-income sites. So through this research and the projects, we're able to provide care to these individuals who might not be able to receive it otherwise.
I'm taking care of the Mandarin and Cantonese speaking patients. When I first came here, they were happy because I can speak like Chinese, and then they will more understand about the program, and then they will know like what's going on, and then remind them to take their medication.
The benefits are huge to have staff that is polished and fluent in that particular language.
Después que yo estoy en este programa, me siento
Ever since I joined this program, I'm very satisfied and have made other health changes, such as losing weight. I feel very happy, and I hope that I influence others to follow suit.
I think this program should be done all over the country because, unfortunately, we're all getting old.
I could tell you that Vital Care will be an asset to any organization, but also they have the energy, the commitment, and the mission. They're very vested.
I know that they're going to tell the doctor if something goes wrong and they don't like your numbers. The nurse takes over, the doctor is told. Everybody's connected with this. It's a wonderful, wonderful service.